Hi, Dr. Moma here, your host on Health and Wellness with Dr. Toby. As you can see, we're going to be talking about COVID-19 this whole week, this whole month. You don't want to miss it. Our guest is Dr. Gerthy Chimaka Anyanwoke. She's an infectious disease specialist based in Baton Rouge, Louisiana. She's the Chief Medical Director of the Infectious Disease Associates of Baton Rouge. You will love to hear what she has to say about the pandemic called COVID-19. We're going to be talking about the cause of COVID, the prevention of COVID, the treatment of COVID. Why has this disease spread so far, so fast? 200 nations of the world, 1.2 million people, 200,000 people dead almost. We need to know what exactly COVID-19 is. And she's going to be telling us what it means for Louisiana going forward, how we're going to break this debacle that has plagued the economy and the society and the church. You don't want to miss it. Look forward to seeing you. Dr. Toby Mama. Hi, this is Dr. Toby Moma, your host on Health and Wellness with Dr. Toby. What an honor, what a pleasure to have you with us today. It's an honor to have you on the screen. Don't touch that dial. I have a special guest with us, and we're talking about, yes, COVID-19. That thing you've been hearing for the last 2 months, and you can't seem to get it off your airwaves. You need to stay tuned because we're going to be giving you the bare knuckles about this virus. I have a special guest here all the way from Baton Rouge, Louisiana, Dr. Gerthy Anyanwoke. She's an infectious disease specialist, and she's also trained from the University of Lagos, sorry, in Nigeria, and then went on to do her residency at the Metropolitan Hospital and at the Long Island Jewish Hospital in New York. She's currently practicing in Baton Rouge, and she is in the front lines of COVID-19. It's an honor to have her with us all the way from Baton Rouge. I just want to say thank you, Dr. Gerthy, for coming all the way. We really appreciate you for taking care of our COVID-19 patients.
It's my pleasure, Dr. Mama. Thank you for inviting me.
Pleasure. So, how's it been? I mean, New Orleans especially, and I guess Baton Rouge has been hit quite hard. So, how are you guys coping in the south of Louisiana? This is the north, and they have a few cases, but I don't think they have anything compared to what you guys have.
That's true. Um, I think New Orleans was hit so hard, and of course, by extension, Baton Rouge, right maybe a couple of weeks after Mardi Gras. So nobody is really sure of how it started, but you have to remember that New Orleans is a tourist destination. So I would not put it past the fact that people brought this in, and especially around the Mardi Gras time. That's what a lot of people are thinking right now.
So far, the numbers are saying we've had, if I think I read yesterday, 1.5 million, maybe more cases worldwide,
Yeah,
and I think more than 120,000 deaths, something like that.
yeah.
And I know New Orleans or Louisiana as a whole has had close to 2,000 deaths, if I remember correctly. Am I correct?
You're correct.
Yeah, about close to 2,000 deaths.
It's impacting
Yeah.
Louisiana on a large scale. I think Louisiana is one of the areas that have the more impact per capita in the
Right.
whole nation.
Wow. At the time we had Mardi Gras, we didn't know there was COVID-19. That's my presumption. Nobody expected it to be on the horizon.
Actually, we knew about the new coronavirus, which is the novel coronavirus disease 2019. It started out in, I believe, an animal market in Wuhan, China. And people kind of think maybe sometime in November, because the earliest case that people can report was, I think, December 8. By December 31st, China reported to WHO in their region
Right.
that they've noticed this
Unusual
unusual disease
disease.
virus pattern. And so from December 31st, 2019, at least the world knew officially
Right.
that this was happening in China. So around February, when we did Mardi Gras, we knew, but they were
Nobody knew what the scale will be.
people weren't told not to go out there,
Right.
to do Mardi Gras and all. So
Hmm.
that's really it. Actually, by then we've had a case in America. I believe in
Right.
Washington State,
Washington State.
middle January.
At that time, people thought it was just, oh, those places where a lot of the, let's use the word Orientals are located. You know, people come from China to Washington, California. We don't have that many travelers from China in our community. It's not going to come to everybody, but voila. Give us an idea of this virus and how how does it successfully transmit so successfully to people? I mean, we've all had the cases of the flu, the diarrhea, bacteria, virus. This is a very successful virus.
And I think that's one of the reasons that it's just gone like widespread. Um, like the flu, if I have the flu and maybe I sneezed here or something like that, maybe one person gets infected, right? But with this virus, I don't think it's only two people that get infected, maybe more than that. And
Right.
then those people go out, and then the same thing happens. The very problematic thing is that a lot of people have no symptoms.
Mm.
And even in the people that that will eventually have symptoms, as early as when they got infected, they are already transmitting the infection.
Right.
So even before you get the symptom, you're already infecting other
Already.
people without even knowing.
And we didn't know that at the beginning. We felt, oh, you had to have fever, but now we think there's a good number of people who are asymptomatic but
I,
transmit the virus while they're the question is how long they're asymptomatic. Some people think 1 to 2 days. We don't know for
we
sure.
don't know for sure.
Right.
We really don't know for sure because there are people that are totally asymptomatic from the beginning to the
To
end.
the end.
They
Mm.
actually, if you look at data that we have so far, 80 to 81% of the population either have no symptom or mild symptom.
80% of those who have the virus.
Yeah,
Okay.
80 to 81% of the people that will be infected
Okay.
have no symptom or mild symptom.
Mild
And
symptom.
that's why I tell my family, my friends, my patients, don't panic.
Mm.
If we just know what to do, we can beat this.
Okay. So my viewers want to know how to beat this because this has thrown a wedge in somebody's cruise plans, holiday plans, vacation plans. Hey, they want to know how to beat this. So Dr. Gentry, help us out here.
So, how to beat it is the same thing the local health authorities have been saying. The stay at home order, the social distancing, washing your hands frequently, um, doing all those things that we've been talking about, disinfecting the surfaces. I saw you disinfecting here
Right.
earlier. Um,
Staying 6 feet apart
Stay
as
six
much
feet
as they
apart.
can.
um, Also, using hand sanitizers where it's not possible for you to wash your hands, like say you're in the public or something like that. And all these measures will help a lot. In fact, if you don't have anything doing outside, stay home. If you have to go out, in addition to these measures, also wear a face mask. Because, for instance, if you're symptomatic or asymptomatic, you can still transmit the virus.
Right.
So wearing a face mask at least limits the amount of
Potential spread.
transmission.
Hmm.
Remember, transmission can be from coughing,
Hmm.
sneezing, or even talking to somebody.
Oh wow. Hmm. So the same rules for engagement from Wuhan, they told us that mostly ear, nose, and mouth were the portals, were the channels of infection. Has that changed? I mean, some people start talking about stool. They start making mention about other means of transmission recently, which we haven't authenticated. But I don't know if you've seen any literature on that.
Well, that's still the case that we know as at this time. We know that the it's from the nose, the mouth, the eye for now. Those are mucosal surfaces. Um, the virus itself can be detected in the stool, in feces. What I have read so far, I haven't seen a case described where the virus was transmitted from the feces.
Right.
But of course, it's possible if that virus is live and
Right.
there's no good hygienic process.
And so far, we haven't. I don't know. They said there was a case of mother-to-child transmission in China, but I don't think we've seen any evidence of that. There was a one-day-old child who came down with the virus, but it didn't necessarily mean it was from the mother.
It's possible that I don't, number one, I don't know yet, and I don't think the community of experts know for sure,
sure,
that there's
right.
maternal to fetal transmission. There's nothing like that for now.
Wow.
What we do know is that once the child is outside, they can get it potentially. And so the advice for lactating mothers, that's mothers that are breastfeeding, is to wear a mask while breastfeeding the child, while taking care of that child, while washing like the bottles, or while even doing the breast pumping procedures, wear a mask.
Tell us a bit about your practice. Tell me how you're handling. How's Baton Rouge right now?
Baton Rouge initially was hit, well, it started out from New Orleans, and then within several days we started reporting many cases in Baton Rouge. At one time, it was really a lot. Right now, I am thinking, or maybe hoping, that we've plateaued,
Okay.
but I guess we need to wait more to see. Um, the the good thing I could say, if it's good, is that majority of the people that are testing positive are doing fine.
Okay.
They're doing fine.
And I know there was a time they said that the hospitals in New Orleans were slammed, overwhelmed, no beds.
At the very beginning, it was
Okay.
really bad. I mean, it's still bad now. It's just that as things start getting better, then you start seeing less cases. Remember now, we are into it's more than, it's about close to 4 weeks.
Right.
They closed the schools about 4 weeks ago,
Okay.
or maybe almost 5 weeks that the schools have been closed. So you can look at that, and they started, once the school was closed, a lot of places started shutting down and working from home and
Right.
stuff like that. So by right, we should see hopefully the decrease. The problem is when we get reintroduced back to what we call normalcy, what's going to
Right.
happen?
What's going to happen? What do you think of the flattening the curve theory? There's this theory about, you can flatten the curve if you social distance. Explain that theory to my audience, because a lot of them have heard it, but they don't maybe understand the full ramifications of what we mean by flattening the curve.
So, if we don't do stay-at-home orders, if we don't do social distancing, if we don't wash our hands frequently, and those good personal hygiene, and all the other things that we've been advised, like wearing a mask, then we'll have everybody out there going about their business, but everybody out there, almost everybody, that can get infected. Now, some people get infected, like I said, majority of them don't have any symptoms. But the people that would have symptoms usually are the elderly people, people with other medical problems like diabetes, hypertension, asthma, COPD, bronchitis, people with cancer, people with rheumatoid arthritis, people with HIV, people that have low immune system
Right.
by nature may get the severe disease that can bring them down to even death. So by asking everybody to stay at home, right, you will still get the disease. But at least you don't have everybody else showing up at the hospital at the same time. Then we're going to lack beds. And you can have you're overwhelming the hospital system, the hospital staff. We can't handle that. So flattening the curve is like now, the curve, like I said, hopefully it's flattening. If we can keep it that way, and the disease is not going to go this month or next month, but just keep it there at a low level, then the hospital system can handle those cases.
Regular case. And all that. Wow. Yeah, it's been tragic. I mean, a family who has a loved one who is COVID positive, what do you recommend to that family? Do they shelter in? Do they relocate? What do you recommend? Because that's what's going to happen a lot going forward. You're going to have one person in the family who's COVID-19 positive, and the other members are asymptomatic, but they don't know if they're positive or negative. What do you do in that kind of situation?
In that kind of situation, you look at what's available for that family. If they have somewhere else to go, I would encourage that, especially if they have elderly people in the family that are negative, that haven't gotten it, or people who have other medical problems that I listed before that haven't gotten the virus. You don't want them to be exposed. Now, that's if they have somewhere else to go. What if they don't have somewhere else to go? Then you want to create a special room in the house for that positive COVID-19 individual to self-quarantine and use one bathroom by himself or herself without mixing stuff with the rest of the family. You want to have the room you're going to quarantine the person well aerated, whereby, air can be going in and coming out. They want to clean everywhere, disinfect everywhere in the home. If they're bringing food or something else for that person, put it in front of the door and leave, and let them open it up and get the stuff. If the individual absolutely has to come out of that room, they should wear a mask. If they need to touch something, maybe wear fresh gloves, but you advise them not to touch anything in the house that may contaminate that surface.
Wow. Wow. That's a very good question. Now the other question is, what do they do? Do they all need to go get tested? Is that something you recommend as well, if they have a loved one who's positive?
Yes, because as at now, and I'm thinking going forward, for us to be reintroduced back to the normal society, I don't see how we do it without more testing.
Right.
And if you have somebody that already has a family member that's positive, even though you're asymptomatic, even though you have no symptom, it's still good to be tested. Because then if you're positive, then you can be quarantined.
Right now there's the 15-minute test, there's the 4-day test. I guess different tests are evolving. So hopefully we have more tests as the days go by.
It's not yet down to the people, except the big hospital systems that get it. And I don't know that that's necessarily the right way to do it, because like it is in my community right now, the hospital system has the 15-minute test. And so if my patient comes in, I have to refer the patient to talk to a doctor that's in that hospital system for them to get the order
So you
to
can't
get the
order it
test.
with LabCorp Quest on your
No.
own? Okay.
The tests that we're still doing are the usual nasopharyngeal tests, and I don't have the kit. Once this has been going on for how long? LabCorp hasn't supplied my office. I have a LabCorp lab in my office.
Wow. But LabCorp they can do it elsewhere if you send them to another LabCorp lab.
No. So what happened is
For the pharyngeal
in
swab.
in Baton Rouge, I think the mayor and some other government officials organized where we can all send an order by the old Baton Rouge General Mid City, and they'll go through the drive-through and get the test done. So you have like the different hospitals around contributing to that effort also.
Okay.
Yeah.
Tell us a bit about your experience, first-hand experience with COVID-19. I mean, you've seen a few cases. I've only had one patient in the hospital with it. So I have seen COVID-19 thank God I'm here and God kept us and the patient did well, thankfully. But tell us about your own experience with COVID-19.
My experience so far has been mixed. On the one hand, most of the patients have done well, but it's never a good day when you lose a patient.
Wow,
And I have lost a few.
wow.
And they had other medical problems. However, they were stable. They were doing okay relatively until COVID-19. And it's hard to see them intubated, being ventilated, and still not do
And I
well.
heard it's a rapid
It's a
decline.
very rapid
Within
decline.
48 hours, somebody goes from talking and walking to just
It's a very rapid
gasping
decline.
for air.
Yeah.
That's unbelievable. So, what do you see as the end for COVID? What do you think is going to be in the spectrum? I mean, what do you see 2 years, 1 year, 6 months from now? We're only in May, April. So, using your ID binoculars, what do you see in down the pipe for COVID-19 in America and the world globally?
I think we will still be seeing, if the stay at home order and everything else goes as it is now, we'll still see some cases, but it will slowly decline. Maybe not to zero, but it will slowly decline. However, if you're talking about reintroducing everybody back into the society, we have to do certain things. We have to do certain things, because how do I know that the person that I'm releasing back into the society doesn't have it? And they may perfectly be fine, don't show no symptom, don't even know they have it because they didn't get tested. But then get out there and infect somebody else that has stayed home for the past 2 months to prevent COVID-19 and come back now to get it. And they might have comorbidities and it might be severe or critical.
My question is, if somebody has COVID-19, will they not eventually become symptomatic? I mean, can you carry COVID-19 asymptomatically for 4 weeks? I think
Yes,
the half-life is, I mean, the incubation period is 5 to 12 days. And what you and I know as incubation period is the time to the manifestation of the disease.
actually,
Not really.
this virus actually infects people before the manifestation.
So my question is, that young man who is asymptomatic should eventually show something.
Actually,
They're
I
going,
would say 25 to maybe 50% of people that have been infected may never show
show
any symptom.
anything. But
And that's
after
the
four
trick.
weeks, will he become unable to infect other people? That young man who was asymptomatic and had the infection,
How do you know if he
he's
stopped shedding the
he stopped
virus
shedding
when we're not testing?
until you test
We
him
need
and
to
he's
do more
negative.
testing to know
Right,
more.
right.
You can't, nobody can emphatically say, oh no, he's not. I mean, right now what the CDC is doing is saying, okay, we think
Based on the
based on
parameter,
the
right.
parameters between this and that, maybe 14 days, maybe 7 days after your symptom, stuff like that. But the patient was not tested. Everybody is not the same. It's not a cookie cutter. Everybody's immune system is not exactly the same.
So for the next 6 months, keep wearing your masks, keep doing this social distancing, keep doing your regular hand hygiene. Maybe even for the next 12 to 18 months.
I have actually heard some people do some projections of 2021 and 2022. So I think we just need to know more.
But you see, we're in the
Maybe.
South, and a lot of people are wondering, how can I go back to church? How can I go back to doing my normal school, kids' school, go back to Sunday school? People are asking, this is kind of the South. They want to know those Bible, what are we doing? Are we kind of stopping churches from meeting, stopping social gatherings? Is there going to be Mardi Gras next year? People are asking those kind of questions.
What I tell my family and my friends and my patients is that here now we have a major event.
Right.
And this is like there's a before COVID-19 and now there's an after COVID-19. We should all like wait for it. We should all figure out how the after COVID-19, after what this stuff has shut down the world.
Definitely.
Commerce, governments, you name it. I think the paradigm has shifted.
It has,
So
definitely.
it's going to be a new normal
Mm.
for all intents and purposes. It's going to have to be a new normal. it's no way we get back to where we were before. We can try to get as close as possible, and the things that would make us get close as possible would be, say, for instance, we found the vaccine,
Right. Which we're
or
hoping to get by
we
next
do
year.
more testing, or we find a treatment. Then you see things start, relaxing a little bit. I mean, prevention is better than cure, right?
Definitely.
So if we can prevent it by doing all the other stuff and a lot of good personal hygiene, it'll go a long way.
What's the magic thing about 50 or 10? Those numbers in a room. What's the magic about those numbers? About 250? I've heard
In
so
terms
many
of
numbers. People
group,
gathering together.
yeah, I think it's just a number, and like you
Okay.
say, the size of the room, right?
Right,
And
right.
at least that's the way they should be saying it. If you have to put
More people in a
10 people in this
right,
room, and each of them have to be at least 6 feet from each other, you may not get that many people,
right,
you know?
right. So it's more of the size of the room and how much distance is in between each person.
Correct.
Right. So Dr. Gerthy Anyawoke has been talking with us about COVID-19. She's a infectious disease specialist, and we're going to continue this. You don't want to miss the next show. She's going to keep hammering on other things, how to obtain treatment, get tested, prevent the infection. We're going to go over and over this because I believe this is a pivotal paradigm shift in the American health system. And we're trusting God that this will not be the end of so many people's lives and businesses and ministries. We believe that God is going to turn the corner, but there are certain things that you, as an individual, can do. As she has shared, social distancing, washing your hands, personal hygiene, and doing the basic things that you can. So I want you to know that COVID-19 is here, but Jesus Christ is also here, and we can beat him using the good sense knowledge that we know as medical doctors, knowing what to do. When Jesus went to the grave of Lazarus, he said, roll away the stone. He didn't tell Lazarus to come out. They did what they did, and then Jesus did what he only could do. So I want you to know that we are not in this alone. God is with us, but I want you to know that there is a virus, and it is able to decimate and devastate the economy and people if they don't do social distancing and personal hygiene. Wear your mask, wear your gloves. That's how we're going to beat this. This is Dr. Toby and Dr. Guthrie telling you that we love you. We'll see you back next time on this same show. Write to me at P.O. Box 550 West Monroe, 71294, Louisiana. Looking forward to hearing from you. You can get a copy of my new book, Spirit of Acceleration, at the www.faithandpower.online. We want you to be part of what we're doing. God bless you. Jesus is Lord. Amen.